All right, Kev, here we go.
Oh God, here we go.
Welcome to Trust Me, This Won't Hurt at All with Dr. Hog. This week, Dr. Hog will explain what the Hog Epidural Hematoma is.
Can you spell that?
Epidural. I will spell it. I actually, if you, hey Jack, can you let me share my screen?
Should be able to. All right, let me make sure. Okay, you're good. You should be good now.
Okay. All right. Epidural hematoma. You guys see my screen?
Yep.
Yeah.
Yep.
All right.
Very fancy now.
I know. I was like doing this PowerPoint and like you could do all kinds of stuff now.
It's like you have a budget.
Well, actually that brings me to the next slide. Let's do my disclaimers here. So first of all, I may or may not be a real doctor. My current or past employers will not be held accountable for anything I say. And no animals were injured during this creation of the presentation. And I did not receive any cash or gifts.
I have a question.
Too bad for you.
I have a question too.
Billy, would you accept cash or gifts?
Yeah. Yeah.
Yes, of course I would.
All right. It's a holiday season, so.
Yeah.
So when you weren't creating this presentation, how many animals did you harm?
I am not at liberty to say.
I mean, I assume you stopped hurting the animals while you made this PowerPoint.
Just so that disclaimer was accurate. Yeah.
Yes.
Perfectly fair. It's a really good point, Dave.
Thank you.
Good on you.
That'll segue into the
Just picking apart the disclaimer.
some ground rules.
Mike, is ground rules one word or two?
It should be 2 words.
I can change that.
All right, just don't harm any animals.
Otherwise, it's like one Norwegian word. I don't know.
It does look kind of cool though. One word.
Ground rules. Yeah, it's got to be some kind of beer.
Round juice.
All right, so there will be trivia at the end of this. So no use of cell phones. The nice thing is we're going to go through the presentation first and then the trivia afterwards. So hopefully you guys will get most of these right. Be respectful of your fellow podcast participants.
Why?
Well,
why start now?
Yeah, that was for Chris, but he's not here. So, and then don't forget to raise your emoji hand if you have a question.
Fair enough.
And then remain professional as we discuss some serious life-saving shit.
Well, again, why?
Remaining professional suggests that we were professional to begin with.
Point. Yeah, exactly.
Definitely a good point. All right, let's get into it. So epidural hematoma is when bleeding occurs between the tough outer membrane of the brain called the dura and the skull. So if you see that arrow right there, you can kind of see there's that whitish sort of convex sort of area. That's the blood. And you can see how it's kind of putting pressure on the brain, which would be the darker gray sort of stuff here.
Yeah. Did you get this idea from Andrew?
No. I think it was just a process of elimination, just going through different things we haven't talked about yet. Hey, Jack.
Are we saving douching for a future podcast? Is that because I was confused here?
Yeah, we'll definitely do douching later.
Okay.
Yeah, we still got room for that.
Okay.
So, as you could, a lot of times what happens, these epidurals, some people have you have initial head trauma, and then you get knocked out, and then you kind of wake up and you feel like, okay, I get this pretty bad headache. I don't feel good. And then you lose consciousness again as that hematoma gets bigger and bigger. And then, so you get symptoms of headache. As that progresses, you get confusion. You might get sick, vomiting. And then eventually, if you get so much pressure on the brain, you might get like a paralysis on one side. almost like a stroke. And the most common, typically, these epidurals occur from a head injury. They do talk about some spontaneous hemorrhages that can occur in certain patients that might have like a bleeding disorder, but most commonly it's trauma related. And see, if you look over here, right here, there's like you can't really see it real well, but there's a fracture in this bone right here. So the head trauma was right here, and then there's a artery called the middle meningeal artery that's right underneath this bone. And so that artery got damaged. And so when that happens, the bleeding occurs within that space right there. Dave, you have a emoji hand up. That's perfect.
This image we're seeing, the white stuff, is that something?
So the very white
Yeah.
stuff that's the skull. So that's the bone.
Oh, so that's bone.
Yep, that's all bone. And then this sort of whitish area is the blood. And then you can also see on the other side of the brain, person also has other types of bleeding as well. So that's all blood there, some blood there.
Yeah. So with this person in particular, and if you're going to get there, I don't mean to jump the shark,
You
but
can raise your hand.
sorry.
Your emoji hand.
Emoji hand.
Emoji hand.
I'm raising this hand. Sorry, I don't really have.
Raise your right hand, Mike.
Will you explain why this person has what they have?
This person?
Yeah. Will you explain what caused, like, the person described in this illustration? What happened?
I don't know exactly. This was just something I pulled off. So it's I assume that this person suffered some significant head trauma. I could just speculate that maybe it was a fall from height, maybe fell off the balcony or something and hit their head.
Gotcha. Okay.
It's not a real person.
Just curious. Thank you.
Jack.
So would you said that the bleeding sort of at like 8 o'clock, would that be because trauma was opposite it and it sort of pushed across? Is that what likely causes that?
Yeah, so they actually call this a contra coup injury. So you get
Can you
hit.
spell contra coup?
Yes. I'm not going to spell it right now, but I will spell it someday. It's two words, I
Part
think.
French?
Oui.
Sounds French.
Oui.
Bonjour.
Yeah,
Brain.
so this person got hit on this side of the brain here. And so when the brain shifted to the other side, it smacked off the skull here, and then more bleeding occurred underneath here. So it's not uncommon to see blood on the opposite side as well.
That's a good call, Jack. I appreciate
Good
Jack's.
question.
Yeah.
Thank you, Mike.
Yeah. Attention.
Yeah,
to detail.
typically we diagnose this with a CT scan or MRI, but CT is more common in the ER. So this epidural bleeding most often from the artery. So as we saw, Dave, do you have a question real quick?
Well, I mean, I think you're getting to my
Raise your
question.
emoji hand.
He did.
I did.
Quick.
It's where is the blood coming from, basically?
Yeah, it's coming from that middle meningeal artery.
Okay.
So most epidurals are from an arterial bleeding. So kind of like in the neck. So that Adam Johnson, I mean, he definitely had arterial bleeding. So that's high pressure. It's just pumping out. Every heartbeat just pumping out. Venous bleeding is a little more slow. It kind of trickles out a little bit more. So it's not as fast. Jack.
You think this guy should have that wisdom tooth pulled? Looks like it's completely blocking his oral.
This one right here.
Yeah, that one right there.
Yeah, this guy, he needs some dental work for sure. So yeah, the arteria is high pressure, so you can tell this this blood right here is just building up quickly. And so it's going to start putting pressure on the brain. And you can see how the brain's being pushed and compressed. And then, that's going to eventually put so much pressure that the brain can start to herniate down into this area here, because all this is a skull right here. All this is, this big, oh, sorry about that.
That's going to haunt
So,
me.
yeah, it's like, yeah. So all this brain has no place to go, right? Except right down here, there's like an opening. That's right where the brainstem is. So if you start to put pressure on that brainstem, you're gonna cause unconsciousness. That's when you get the unequal pupils. You may get some abnormal posturing, some paralysis. And if it keeps happening, you'll go into respiratory failure and you will die.
That doesn't sound good.
It's not good.
Yeah, that sounds fatal.
So what do we do on a trip?
We're getting there.
All right,
It's coming.
all right, my bad. And
We call camp.
who did the album Brain Salad Surgery? I can't remember the name of the band, but there was an album Brain Salad Surgery.
It's
Is
not
it
in my
Emerson,
trivia.
Lake and Palmer?
I think it sounds right. Yeah, I think you're in that neighborhood.
That's impressive. So there's a term called anisocoria, and I spelled it wrong. Anisocoria is a term for unequal pupils. And again, when we see this in the emergency room, it's kind of a late finding. So they're probably already unconscious. We'll probably already have them on a ventilator, and it's not a good thing. So when this happens, now it can also be a normal finding. Some people have unequal pupils, and they're born with it, or it's just a congenital abnormality. Or sometimes somebody may have put an eye drop in one eye that dilates the pupil, so that can happen too.
So bleeding on the brain can cause your eye pupils to how does that happen?
Yeah, so if we go
Pressure on
back
the
to that,
eyes.
if we go back to that
that
pressure,
pressure.
so this pressure of the blood is pushing onto the brain.
The
And-
occipital lobe.
Yeah, actually where this is the occipital lobe is obviously down here, and this is the temporal lobe over here. But if we were to go a little bit sort of further down in this CT scan, you would see where the eyeballs are and where the optic nerves are. So when you start to get pressure on those optic nerves, then one pupil is going to dilate.
Wow. All right.
And Dave, you were right. It is ELP did brain salad surgery.
Yes. I
Good
got the
call.
first trivia question.
Yeah.
There we go. Obviously,
All right, here we go.
This is a schematic, but treatment of generally urgent surgery in the form of a craniotomy or a burr hole. And
Burr
again,
hole.
without treatment, you will likely die. Obviously, this is just a schematic. This is somebody's CT scan, and they're just showing you where you have this sort of like a stopper here, so you don't go too far. You know how you're drilling into the wall and it goes poof. Yeah, you don't want that to happen. So you only want to go so far into that, just enough to get through the skull so you can drain that blood out.
Good job, Mike. You
Yeah.
put your hand up.
Oh yeah, go ahead, Mike.
Dr. Hog, how thick is a human skull? Like the bone, how thick is that?
And does it depend on the person?
It's definitely so the guy that sits in front of Dave during the concerts, he has the thickest skull I've ever seen. His brain is this big, but his skull is, yeah.
Right.
So yeah, it can vary. Probably 5 millimeters. It's probably 5 to 7 millimeters is probably, but it could be thicker in certain areas. So it's real thin right here. It's a lot thicker up front.
Okay.
So, if we did go back to that picture here, you can see how thick it is here
Yeah.
and a lot thinner here.
All right.
So this is where if you get hit in the head, try to avoid this area, the temporal region, and then either hit in the back or the front. It's much better.
Remember that, Pat.
Check.
Are you guys cool if I use some of the podcast profits we buy Dave one of those telescopic things so he can see over the giant skull guy at the show?
Yeah,
I should get one of those.
Absolutely. You can use.
I should get
all
one of
our
those
profits.
things that they sell at golf tournaments.
Yeah, we've had one
Exactly, yeah,
the little
periscope thing.
milk carton telescope.
Oh
yeah.
my God. That's such a great idea. I could finally see these shows that I'm paying all this money for.
Did you stay for the whole show, Dave?
It would be great.
So you were right. That show is really good. I
Yeah.
really enjoyed it. And I learned that if I lean forward and to the right, I can see it.
Okay.
Except when he moves his head to the right, and then I gotta pull back into the left, like Kennedy, back into the left.
Yeah.
So I'm
you're
constantly moving.
So you're
during
always
the
moving.
show.
You're like chucking and jiving the whole show.
I'm weaving. I'm like Ali in a title fight.
And I'm sure the people behind you are just as happy, right?
I'm sure they are.
Yeah,
but
Well,
obviously
you're a short shit though, so they're like everybody's looking over you.
they see the head in front of me. They know.
That would be funny if the actors sort of caught wind of the whole whatever row that is. Everybody swaying at the same time.
I guess say it probably goes all the way back. It's a ripple
Forget-
effect. To the
forget
back
their
of the
lives.
Oh my God.
Dave, do you get uncomfortably close to him when you
Yes.
lean forward?
Yes, I do.
Yeah.
Yes, I do. I can smell them.
Oh, geez.
Dave, I'm thinking a drill to the back of his head will solve your problem.
Little drainage will
I'll bring Kip with me to the next
Sir,
show.
you look like you're having an epidural hematoma. I
Bring
will
the
take care of this
2/4
for you.
Bring the
Yeah.
2/4 bit inch or 2/4 bit.
Yeah, definitely. Yeah, I'll bring my tools next time. All right, so epidural hematoma, it's a surgical emergency. So if you delay the surgery, it can result in permanent brain damage or death. And typically without any surgery, you are going to die, most likely. And basically it's the cause of death typically is that expanding hematoma that puts pressure on the brain, and then the brain herniates through the brainstem. And you pretty much have to remove that blood. Otherwise, it's just going to continue that pressure on there. And you can do a craniotomy, which actually, that's actually removing a portion of the skull. So you actually kind of cut, a piece of the skull out. Or you could do the burr hole, which is sort of more like a temporary sort of maneuver to kind of at least take some of the pressure off initially. And then craniotomy could be more of a definitive management. It'd be Pat, Dave, and then Jack is no longer.
Delayed surgery is bad. And what is the time frame here? Like how soon do you need to get yourself to the hospital if this happens?
Yeah, it's going to be
Like
pretty soon. Quick.
Minutes.
Yeah. It could be, it kind of depends. I mean, it really depends on how much blood is in there and how much pressure is happening. So it can be variable, but I would say you probably, if you don't have surgery within, 60 minutes or so, you're probably dealing with death. So, Dave.
So since this is so serious, I assume there are times where you can't get to the emergency department. So can like EMTs do this in the field? Is this like some kind of in the field type situation? No, you're saying no.
It's a good question. So obviously in the ER, I'll have a CT scan, so I'll be able to actually see the blood, and I'll be able to kind of know where to put this tool to trephinate to drain the blood. So if they don't have that CT scan, it's going to be very difficult to determine, where to put that
Okay, got you.
burr hole. But
Right.
they do say if you're in a situation where you suspect that if they have a blown pupil on the right side, you would drill on the right side. So you drill on the side of the blown pupil if you don't know for sure.
Okay, so I'm just thinking if we're all on a trip together and maybe you're not there, and let's say Jack falls down and he has a blown pupil on the right side, and I have a drill. Could I just drill into the right side of his head and hope it hits the blood? And maybe it'll just leak out the side?
Yeah. I mean, his family's going to sue you for like lots of money, but
I'm
yeah, I
just
would.
trying to help.
Yeah. Yeah, you definitely going to. Yeah, you definitely want to go on the side of the blown pupil. So yeah, I'd say go for it.
And
So-
Jack's 100% on board with that.
Sounds like Jack has a question.
No pilot holes is what I heard is the.
Yeah, just go for it. Big
So
hole.
my
Boom.
question was, how's this different from the run of the mill concussion?
So, concussion, you're not going to have any, typically there's not bleeding in the brain.
Okay.
You're going to get some shifting of the brain. Your brain's going to kind of bounce off the inner portions of the skull. And you're going to get some, symptoms, maybe loss of consciousness. You might get some headaches, some confusion, but typically there's not going to be any bleeding with a concussion.
Okay.
So they do talk about, if for some reason you have this person with your CT scan, you get an epidural, and there's no way you can get this person to a trauma service or a neurosurgical service, to have this procedure done in a timely fashion, then, it's a procedure that ER doctors are not necessarily trained in. It's something I've never done. And not too many of my colleagues have ever done, but it's a procedure that, potentially could save somebody's life if it's done quickly and, appropriately. So it's, again, very uncommon procedure, but go ahead, Dave.
Dr. Hogg, you've been a doctor for theoretically how many years?
In theory, 26 years.
Okay. I feel like I've seen this procedure done on ER at least 300 times.
Right. Definitely Hollywood, definitely puts a spin on it for sure.
It's a Hollywood procedure.
Yeah.
Okay.
So the prognosis, yeah, go ahead.
I'm sorry, go ahead. No, go ahead.
The prognosis, if somebody comes in and they're just in a coma right away, they hit their head, they never wake up, that's probably a bad prognosis. If they do hit their head, they wake up and then they start to decline, then that there's probably some salvageable brain there. So a little bit more better prognosis if you're younger age, or you're more healthy and stuff, you probably have a better prognosis. If your pupils aren't unequal, or they talk about a blown pupil, if it's not unequal, then you're probably a better prognosis. And then there's something that's called a Glasgow coma score, or coma scale that we talk about. And it's a clinical scale you use to measure the person's level of consciousness. And you basically get 3 to 15 points. 15 points, you're awake, alert, oriented, and that's the best score you can get. A score of 3 is bad. To be Jack and then Dave.
Can we have Mike crush 3 more celebrations and then have him do the Glasgow coma score test?
Absolutely. My next slide will show that.
Fair enough. I have 3 celebrations left and some Kilbeck Scotch or Irish whiskey.
Dave, what was your question? Same thing.
My question is, does the Glasgow coma score come from Scotland?
That's a good question. I believe it is.
Okay, so it would be the Glasgow coma score.
Or, yeah, if you're French, it's Glasgow.
And by the way, where did they get a scale of 3 to 15? I mean,
Yeah,
come
right.
on, 1 to 10?
Yeah, it's like 1 and 2 don't matter.
3 to 15? What's that?
Here we go. So I'm glad you asked. 'Cause-
See, he's got it there.
So Glasgow coma scale.
Glasgow.
Glasgow. GCS can also be used to determine how many shark attacks a person has consumed. And that would be Dave.
We would have drilled into so many people's heads if we did this on trips.
Oh, Lord.
Dave's at a 4.
I
Yeah.
love it. That is true too. Like all those descriptions are very much on point for Dave. On
I have never
shark
blown a
attack.
pupil or other things.
I don't know, Dave. That best verbal response section's calling your name big time.
Incomprehensible sounds.
Incomprehensible sounds, maybe. Okay.
So yeah, if you have no response to eye-opening or verbal response or even moving, that's where you get your 3. 1, 2, 3.
Okay. Gotcha. So you're adding up 3 different categories.
Yeah.
There's
Yeah, you would think that maybe they should have just started with 0, right?
Right.
0,
Yeah.
0.
Right.
Yeah, why would you
0.0.
for 1 for nothing?
Those Scottish people are so crazy.
It's like 3 points for goalie goals.
that's actually it. All makes sense to me, to be honest with you. And I'm clearly I'm a numbers guy.
Good. Jack, you have a question?
Yeah, so the eye-opening response, that's also the Hollywood where they pry the open, shine the flashlight in the eye. That's how you do that one?
Yeah, or you just ask the person to open their eyes, and if
I was thinking if they were, I guess if the motor response was nothing, then.
Oh, Kip, you're great.
yeah, no, really, no. If obviously if they're opening their eyes spontaneously, and then if you ask them to open their eyes, you get a 3. If you like pinch their skin or you give a pain response and then they open their eyes, that's a 2. And then obviously if they don't open their eyes at all, it's a 1.
So under
Yeah,
best
that
verbal
makes great sense.
response, there's something called inappropriate words.
I was,
Can we talk about what those words are?
Motherfucker.
No, that would probably be appropriate.
Oh, really?
Yeah, I mean, if you're
Inappropriate would be like, "Mommy, make me soup."
yes, exactly. Right. That's perfect, Mike. Like if you're in a head injury and somebody's about to really drill your head, you probably say, "Wait, motherfucker." But
If you say, "Mommy, make me soup," like it's like, drill deeper.
all right, it looks like it's time for the video time.
Oh, we got a video.
For YouTube copyright, we need to.
oh, we've worked our
Okay.
strikes off, so we're good.
All right,
We're good.
Hot
let it
dog.
roll.
Here we go. I'm getting a beer.
Would there be a disclaimer before this video?
Viewer discretion is advised.
Thank you.
I'm Dr. Jessica Mason.
Hey
This
now.
is going to review the rare and potentially
drill somebody's
life-saving
hole?
procedure of a cranial burr hole.
Or a head in
We'll
somebody's
review the
hole?
equipment and then walk you through the procedure step.
Or a hole in someone's head?
Let's start with the equipment. You'll need hair trimmers or a razor, skin prep, a sterile drape, a scalpel, a self-retaining scalp retractor, your trephination device. Shown here is a hand drill and also a Hudson brace, which is how this procedure will be demonstrated, a skin stapler, drain, and gauze.
All common stuff you have at
Scanner
home.
for site selection. Also, measure the depth to the inner table of the skull and set your stopper to this maximum depth. If no CT is available and you must,
Oh yeah.
Oh no.
it's 2
Here we
centimeters
go.
anterior, 2 centimeters superior to the tragus on the ipsilateral side as the blown pupil.
Let's drill that old man.
Superficial
That is
temporal
the
artery
nastiest
and
ear
stay
ever.
anterior to it. though it is very likely you will transect the frontal branch. So be
From
prepared
years
to
of
manage
wrestling.
bleeding. For the same reason, it also helps to inject lidocaine with epinephrine.
What's they call that?
With this
Cauliflower?
knife, now make a 3 to 5 centimeter incision all the way down to bone.
Oh,
The scalp protector to expose the skull.
whoa.
The
They didn't
skull-
warn us on that one.
The outer and inner tables are compact bone, and sandwiched between them is spongy bone. Now take a deep breath
Spongy bone.
because we're ready to trephinate. You may have an electrical drill or a manual drill like the one shown here, which actually has a hand crank. This one also has a stopper.
I gotta
that
tell you, I got turned on when she said we're ready to
If
trepanate.
you have a CT
Just in
scan,
case the power
measure
goes
the
out, you
depth
have a
of
hand
the
crank.
inner table of the skull and set the stopper accordingly. This video demonstrates the Hudson brace, and in this case, we first attach the perforator bit. Once you get through the outer table of the skull, you switch to the conical burr.
Of course you did.
The Hudson brace, you apply a little bit of pressure, and then you rotate to drill.
Wow.
Oh my
Start slowly so
God.
that you don't fall. And it's
Wow.
important to have an assistant to help stabilize the head. This should become a smooth and continuous
Holy
motion.
shit.
Well, as smooth as it can be with the adrenaline that's probably pumping through your veins. If your
I
tool
thought
is
you were
sharp,
literally talking about a Black and Decker.
apply a little bit of constant pressure as you drill.
Why don't they have power
Stop,
tools?
check where you're at as frequently as you need to make yourself feel comfortable. You can see here we're still in the smooth outer table of the skull.
Oh,
With
his ear
Hudson
looks
brace,
even
You're going
weirder.
to start to get this jerking motion that you'll feel as you get into the inner table of the skull. And you
Yeah,
can
jerking
here, this
motion.
layer is much
Oh.
softer.
Ah,
Now switch to the conical
oh,
burr.
Kip, what are you doing to us?
This will now clean out the area and expose the dura mater underneath. The rotating hand should provide counter torque and resist forward motion of the drill so you don't plunge it into brain parenchyma. This soft layer that you
Oh.
see here, that's the dura. So if there was an epidural hematoma, it could be evacuated at this point. And you can use irrigation and suction to remove the clot.
Did you say if there was, does he not have one?
Subdural hematoma, we need to go one step further.
Yeah.
Alternatively,
Cadaver.
if you thought it was an epidural, but you don't see blood.
Oh,
at the
this guy's dead?
we need to open up the dura.
Yeah,
Use the
he's
scalpel
dead.
to make a 3-sided incision, so a window in the dura.
Oh, we're going to town on this
done with an
dude.
X-shaped incision. With the subdural hemorrhage exposed, you can irrigate and you can blot, but do not suction because you might rip some of those little bridging veins and worsen the bleeding. Now you're pretty much done. Our neurosurgeon peer reviewer recommended that you leave a drain in place and staple the skin closed for hemostasis during transfer. If you've attempted this procedure blindly because you didn't have a CT scan and you did not find the hematoma, you're going to repeat that temporal burr hole, but on the contralateral side. Now, if you still didn't drain the hematoma, go back to the ipsilateral side, and for a frontal burr hole, you start midline to the pupil and you go back to the coronal suture, just about 1 centimeter anterior to it. If you still didn't drain the hematoma, you can attempt a parietal burr hole. Start at the external auditory meatus and go about 3 centimeters superior and 4 centimeters posterior. So you're over the parietal eminence.
I swear she has an OnlyFans page.
Just keep drilling.
I said
That's-
basically what it sounds like. Just keep drilling until you find it.
Just keep drilling till you
Just
find
keep
oil.
drilling,
Drill,
drilling.
baby,
drilling.
drill.
Why do they have a hand saw drill thing?
Yeah,
why,
don't
isn't that? Why isn't there a power one?
So
Well-
I mean, they do have those too. I think they just maybe they couldn't afford it. I don't know. Maybe but they do have like a hand crank one. They have that sort of
Hold on a
other
second.
one.
Pip, stop sharing.
Oh.
I think that's my YouTube channel still going.
Chronic subdural hematomas are typically a disease of the elderly. So what happens is that elderly patients tend to have more atrophic and shrunken brains, which
How do I
causes the
stop
bridging
it?
veins to stretch.
Okay, sorry about that.
Makes sense.
Yeah.
All right, we're good. Share my screen now.
Yeah.
Oh, wait. Before you get to that, I have 2 questions.
Yep.
You called this an epidural hematoma.
He didn't. It's a medical term, Dave. It's not like Kip came up with it.
Well,
Kip, you used a medical term called epidural hematoma.
Yeah.
And my question would be, so I know the term epidural by my wife getting a shot during pregnancy or by childbirth. How is that related to your epidural?
So that dura that we talked about, the dura is that covering of the brain. It also covers the spinal cord all the way down through the back. So the epidural is outside of that dura, and a subdural would be underneath that dura.
Okay, gotcha.
So when they're giving a shot for pregnancy or an epidural, they're giving that anesthesia outside that dura, and it just goes into that space to help kind of numb that hole from like the belly down.
Okay. And then
Mike.
my second and final question.
Final.
Final for now. The first image you had of the brain, and you had the white, the skull around it.
Yeah.
Is it? Yeah. So that one. So people's brains can, like, I don't know how to put this. Is like a dumb person's brain smaller than a smart person's brain, or are they all the same size?
I would say that it's probably not the size that matters in this scenario. It's probably,
yeah, you would say that.
it's probably about how those neurons are connecting, and how many of those neurons you're actually using, and how many you have killed with how much alcohol you drink.
Gotcha.
So
Okay.
Man, my brain is fucking shrinking.
Mikey.
So the last episode of This Won't Hurt, we talked about hard dicks. This one, we're talking about brain bleeds. And this is going to sound weird, but can we?
You want more hard dicks?
I don't know. Maybe it's just me. Like, this seems too serious. Like, can we go back to the hard dicks?
So, no.
For what it's worth.
Well, yeah, I think we'll get into soft in the douching category. So maybe we'll get into that.
Fair enough. Fair enough.
All right, you boys ready for some trivia?
Yeah.
Yes.
Okay. All right. Question number 1. What is the coma scale? So it's a clinical scale used when one Scottish rugby player renders another one unconscious. A Scottish punk rock band. A clinical scale used to measure a person's level of consciousness after a brain injury. Or a clinical scale that measures the degree of drunkenness they've achieved while visiting Scotland.
So are we supposed to record these numbers somewhere?
Just shout them out.
Say them. 3.
Yeah, definitely 3. Question 2. What is the typical shape of an epidural hematoma? Concave, convex, octagon, or star-shaped?
Ooh, if I knew what any of those words meant.
Can narrow it down to 1 or 2.
Yeah, I'm gonna go. Yeah, I'm gonna go 1.
Good choice.
Yeah.
Concave is more elliptical, like a lens. Convex is sort of like caved in.
Yeah.
All right. Question 3. Injury to which artery is the most common cause of an epidural hematoma? Subclavian, vertebral, radial, or middle meningeal? Middle meningeal.
Cool.
We did mention it.
Vertebral is like the vertebrae is down the spine, right? Radial is something else. I'm gonna go 4 or 1. 4 or 1.
So 4 is the right answer.
All right.
the middle meningeal. Remember the
Way to commit.
temporal
Mike,
bone?
way to commit.
Well, that's right. Meningitis is brain related. Yeah, right.
That was good. Good word association. That was perfect. Question 4. Which celebrity died of an epidural hematoma? Jim Morrison,
Too
Princess
soon.
Diana, Natasha Richardson, or Sandra Day O'Connor? Is that too soon?
Too soon.
Too soon.
Oh,
Dave's going 3. Jack's going 2, 2.
I'm going
Mike?
2.
All right, Natasha Richardson. She is the winner.
Ooh,
That was
Gotcha.
Liam
Question.
Neeson's wife.
I was saying, who's
Wait,
Natasha
or-
Richardson?
how
That
did
was
you-
the skiing incident, right?
that was skiing. Okay.
Yeah, she had one of those where she hit her head. She got knocked out. Kind of went home awake afterwards, and then she kind of died in her sleep.
what? Where was the? Who is she, and what? Where was this?
It was Liam Neeson's wife.
She was an actress herself, right?
Yeah,
Yeah, she was. It was
Yeah.
somewhere in Europe, I think.
yeah. I think it was like
I
in
think it was. I didn't think it was
Alps
Diana
or
because
something. Yeah.
Diana was basically just crushed, right?
She died of what's called a thoracic dissection. So her aorta dissected when she had that impact. Like her aorta sort of tore the big large artery through the body. It ripped and tore.
Ooh, you don't want
So-
that.
That's bad.
Oh, that's Liam Neeson's wife.
Yeah.
Or
Uh,
ex?
It was.
Was.
Yeah.
She was taken.
She was.
3 times.
Oh my god, Dave, you're going to hell.
All right. Question 5. What is anisocoria? A prolonged unwanted
No,
erection.
no. We know it's not one.
Fear of anus,
Uh,
unequal pupils, or a poisonous tree frog.
So number 3.
I'm just happy you spelled it right here.
You
yeah.
guys are listening.
I have a question.
What did he spell right? Erection or anus?
Anisocoria.
So I have a question, Dr. Hogg.
Yes.
It seems to me as we do these and we have these trivia questions, you're going to have to go to more than 4 answers because I have a feeling that 1 and 4 in this one, they've been pretty common answers throughout the trivia questions over the. So you're going to have to probably start to get into 6 and 7 answers as we build up.
Well, I think Mike did want to get more into number 1, so this is an opportunity for him.
That was fair.
Now you're making it sound bad.
All right. Question number 6. And we'll wait for Mike because he knows this one. What famous singer had anisocoria? Is it Elvis Presley, Bing Crosby, Chris Cornell, or David Bowie?
Elvis. And you spelled Elvis Presley, or you spelled Presley wrong.
That's how we spell it in French.
Said Mike would know it. Mike just blew it. All right, we'll go with that.
Yeah, I actually don't know it.
Oh,
I'll go opposite.
I was gonna go. Yeah, I'm going 3.
Oh, I'm
All
staying.
right. David Bowie.
Ugh.
Oh, really?
You ever look at his eyes? Looks like he has one different colored eye. It's actually just his one pupil is bigger than the other.
Bigger? Okay, all right. Huh.
Never noticed that.
Yeah, because like Bowie died of cancer. Like he predicted his death. He knew his death. He recorded his
So-
last.
So yeah, he had a congenital anisocoria. So he had it was from birth. He always had a pupil that was bigger.
Yeah.
There you go.
Yeah.
Huh.
Oh, there it was close up. Oh, that's freaky.
Yeah.
It's like a Bond villain.
Yeah.
Yeah.
The CEO of Citizens has that. Does that mean he's going to die? Well, I guess everybody dies.
If he had
Liam said.
the downside is, let's say he had hit his head and you didn't have a CT scan, and some gung ho guy was like, I'm going to drill this guy's head, that would be bad because there would be no blood there. Jack,
But you would just keep drilling then, right? If you don't get it the first
keep
time,
going.
you
Yes,
just keep drilling.
absolutely.
Keep
I think
5
this
holes.
is a legit medical question, I think. So if if David Bowie, and it's just a normal condition, does his brain adjust to that increased light that comes into the pupil that's bigger so that he can actually, that you just normally account for it?
Yeah, I mean, good question. I don't really know the answer. If I would assume that since he had it since birth, his brain probably does adjust to it.
Yeah. So when he goes to
Mikey.
the doctor and they dilate his pupils, and it's like, wow.
I just wanted to
Go ahead, Mike.
congratulate Dave and Pat for making Bill Demchek the American Banker of the Year. So congratulations, guys.
You're welcome.
Yeah, thanks.
Congrats, Jack.
Mike, is there something about this podcast where you got to leave me out of everything that you're doing with everybody else?
Yikes.
Hey, we talked about Savannah early on, and my friends who I greatly appreciate. So truly, I should raise my hand. Jack took care of 3 good friends of mine, setting them up for a very, very, very low cost at his place, which was awesome and incredibly kind of him.
Till I pee in all your closets.
I just want beer for life in Pittsburgh. That's all I want.
Yeah, now the Brewers Guild chairman
Yeah, that's right.
person.
Let's finish Kip's thing, and then I do have a little comment to say about the Brewers Guild thing.
That's so question 7. So which medical specialty typically manages epidural hematomas? Be the gynecology, urology, neurosurgery, or psychiatry? Yeah, that's an easy one. It's a bunny. Question 8. All of these are common symptoms of epidural hematoma except headache, vomiting, confusion, fever. Yeah, gotcha. Another easy one. All right. Which of these is not a type of intracranial hemorrhage? The epidural hematoma, the subdural hematoma, subarachnoid bleed, or the subungual hematoma? All right. So number 4, the subungual hematoma is not an intracranial. So all these are intracranial hemorrhages.
Okay. Well, what's subungual? What's that mean?
Well, there you go. Bonus question.
I just want to know if that was all part of the lecture.
I did touch base on a few of those items,
Okay.
but you had to listen closely.
Is subuncle not in the brain?
It's not.
Sounds like a made-up word.
It sounds like fungal.
It's under your ungle.
It's in your feet.
You guys are
It
getting
sounds like
you're getting
underwear.
close. You're getting close. I can see how you're working through this.
I mean, there are 3 U's in that word. There are no words in the English language that have 3 U's.
I mean, apparently it's under your ungle.
That's what Pat just said.
So ungual.
It's got to be. I'm just saying, where else could you get hit that bleeding would cause a big issue? I'm thinking somewhere around your heart.
Is it related to any other parts of the body that were part of a previous podcast?
I don't believe we touched on this part of the anatomy.
Okay. Knee.
Good guess. Not right. It's not cardiac either.
Stomach.
So have you ever been hammering a nail and you hit your finger
Oh.
Yeah.
and
Yeah.
and that
Yeah.
blood gets underneath your
Yep.
nail?
Yeah.
Yep.
That's a subungual hematoma.
Okay.
And treat it just like the brain. We,
Oh, you can drill it.
Yep.
Yeah.
trephinate right through the nail plate, and that blood put. So it's almost like a burr hole for the nail.
Yeah.
But so is that any extremity? So if that happened on the toe, it would still be called a salagum?
Correct. Any finger or toe.
Extremity, we call those in the language.
The doctors call them that.
You're not a doctor.
Let's try. I was fake.
I'm not a doctor either. That's all I got, guys. Is that good?
Good job, Kip.
Excellent Dr. Hog
Thanks.
segment.
Very good.